Hi, it's me again, Tom McLean, and we're going to do a quick demonstration with a little bit of information about how to use the Ezio. And the first thing I thought we ought to talk about were the particular indications for the use of the Ezio in the pediatric patient. And those indications are life-threatening illness or injury in a child after effective ventilations have been established. And a child, as described for our protocols, will be any human that fits within the length of the Braslow tape. And those life-threatening incidents that we just described include cardiac or respiratory arrest, major trauma, and patients requiring rapid sequence intubation in the absence of vascular access through the normal venous approaches. Once you've established that there are indications for the use of an Ezio, you need to make sure that you don't have any contraindications. And there are a number of contraindications to keep track of when you're performing the Ezio, and one is previous fractures in the bone that you're going to do the Ezio, previous attempts of an interosseous access in the bone you're looking to use, osteogenesis imperfecta, which is something that I probably wouldn't be able to identify, but I could be informed of, and osteoporosis, which is also another consideration, not likely in a pediatric patient, but certainly something that might be evident in an older adult patient. You've cleared the contraindications, now you also have considerations, and some of the considerations for use of the Ezio are deep burns, cellulitis, and other infectious processes that might introduce infection into the bone of the vascular system when you introduce an IO into the bone space. So those are the considerations that you have to keep in mind as you're proceeding with the use of the Ezio. So with the proper indications in place, no contraindications, and you've considered the considerations, let's go ahead and do a demonstration. Hi, this is our demonstration for the Interosseous 101 Ezio. And in this process, the first thing we want to do is make sure that you protect yourself using body substance isolation. You've already identified the patient as a candidate for Ezio insertion. You've gone through the contraindications, found that the patient has no contraindications to use of the Ezio, gone through the considerations, and taken those into account when deciding what you want to do as far as cannulation for this patient. The first thing you need to do is go through your setup. You want to choose the proper IV fluid, check it for clarity and expiration. You want to select the appropriate equipment to include your IO needle, the syringe, a syringe with fluid in it, or saline, and an extension set. And you want to make sure that the extension set is filled with fluid. You want to have your proper administration set attached to your fluid. You want to make sure they're connected and working properly and half the chamber is filled. And you want to cut and prepare tape and any stabilizing equipment that you might need for patient care once you've established the IO. The next step is to locate your landmarks on the patient. For our patient, we want to go 1 to 2 centimeters below the bump in the knee and to the medial side. Once we've selected our point, we want to clean it thoroughly. Then we want to prepare the Ezio needle and driver set. And the preparation is simple. Just place the Ezio needle set onto the driver set and it will attach using a simple magnet attachment. Then you want to remove the needle protector at the end of the IO set. You want to stabilize the patient's leg and insert the Ezio using a gentle pressure and recognizing that the rotary action of the drill will actually start to set. Once the release or pop has been felt, you want to remove the driver set from the needle set. You want to remove the stylet from the catheter, place that in a sharps container, attach the extension set, syringe, and saline fluid, push 2 cc's, make sure you have even flow, withdraw to help confirm placement by identifying blood return or marrow return, and then insert approximately 10 cc syringe bolus. At this point, we want to secure the needle set. We use a bulky dressing secured using tape, making sure not to use circumferential tape to cut off any circulation. And at this point, we want to attach our infusion set and as we attach our infusion set, we want to initiate flow using pressure. So the IV bag of fluid should get a good squeeze to ensure proper fluid flow into the patient. Once we've administered the fluid, we want to make sure that our extension line is secure and we can administer as we would any other medication or fluid for our patient's needs. At this point, we want to make sure that we're considering any of the complications associated with interosseous starts. Once you've established your EZ-IO, secured it, and made sure flow is good, you have some potential complications that might come about with the use of the EZ-IO. The first one is extravasation or compartment syndrome due to extravasation if it's unidentified. Pressure builds up and can cause that compartment syndrome. The second is a fracture of the bone. If excessive pressure is used or the catheter is not properly secured, motion may cause fractures of the bone. A fat embolus. This is a theoretical complication, but it still exists. It's never been produced in a human patient, just animal studies. And the fourth is osteomyelitis, which may occur after the needle has been in place for extended periods of time. The EZ-IO is intended to be removed within 24 hours of insertion. So theoretically, osteomyelitis would probably not be something we see in the pre-hospital setting, but should be the removal within 24 hours should be mentioned to the staff when you drop the patient off and make sure that they're aware of the length of time that the IO should be in place. So hopefully you've got a lot out of the indications, contraindications, considerations, the demonstration, as well as the complications associated with this. We wish you good luck and thanks for your time.